3, 2. Hello, everyone. We're live again from Ave Maria, Florida. This is Dr. Raul Enad from Cadenza Medical Clinic. Today, we're going to talk about arthritis, microbiome, and PRP. So, there's a link. The new treatment is PRP. I hope it becomes a gold standard in the treatment of PRP. But behind that, it's actually the microbiome, the bacteria, the good bacteria that we are trying to promote. And I'm going to explain to you the link of inflammation on all different arthritis. So if you like this topic, hang on to the last minute of the video, and you can post some questions wherever you are. Stay online, and we are going to start. So arthritis, as most we know, is we call a inflammatory arthritis. It comes in a different recipe, like rheumatoid arthritis is most common, which is a part of the autoimmune system or autoimmune condition, together with Hashimoto's, multiple sclerosis, lupus. They're all the same. They come from, in theory, they come from the gut dysbiosis and leaky gut. And I'll explain that in a few. Second, or another autoimmune problem is psoriatic arthritis, psoriasis that manifests as flaky lesions in the joints and usually affect also the joints, especially the knuckles, big and small joints. The one that's most common that we call as arthritis of wear and tear, that's usually what we know or what we used to, we're taught that osteoarthritis is not an inflammatory condition, but rather just a wear and tear. But beyond that, we now know that osteoarthritis is actually not just a wear and tear. It has a common denominator for all the different arthritis. It's called inflammation or aging. No, welcome back. No, we are having a talk. Come. Yeah. Sure, no problem. So the inflammation is sometimes you cannot separate inflammation from aging. When you're inflamed, you age. And there's a term that they coined now as inflammaging. So what is inflammation in essence? Inflammation is essentially the classic presentation of redness, pallor, dolor, color. Red, pain. And so that's the classic presentation of inflammation. But that's the end stage of the inflammatory process. Behind that, before that, is actually inflammation microscopically, and that is measured by very simple tests. What are they? And if you're my patient, you will always look for evidence or indirect evidence of inflammation. One would be sugar, fasting glucose, or even random glucose. Fasting glucose is defined not in the diabetic range, but before that. Any blood sugar of above 100, for sure there's inflammation. That's why it's one of the criteria for the metabolic syndrome, which can be explained by the substrate of inflammation. Before you become diabetic, you're already inflamed if you have a blood sugar of 100. But you can never tell that if you don't get tested well. Another source of information is hemoglobin A1C. What is hemoglobin A1C? It is the amount of glycation, which is a process of aging, that is a result of the glucose exposed to heat. And in the system, when you are having this condition of glucose, for example, in the red blood cells, it tells you how much of the red blood cell is soaked to the serum glucose, because that's the lifespan of the red blood cell is about 120 days. So it measures how many days or how much of glucose your red blood cell had been exposed. You can come in. The amount of glucose there's at least seven substances that they identified as AGE, or advanced glycated end products, properly identified or acronym as AGE. But in reality, these are the same kind of uh, of substance or products of aging, usually associated with protein and sugar in high heat. So what I'm getting at is, if any of those preparation of food that you like is marinating with sweet sauce and putting it in high heat, like grilling or high oven, that can give you those substances like age. It ages, it inflames your system. What other food can you think about? Uh, Crackers, for example, chips, because that's generated by high heat. Think about that. So the safer way would be to marinate it with lemon vinegar, because that improves your insulin resistance, and also cooking it in with um, steam or boiling is what I'm trying to say. So that's the practical thing about age, advanced glycated end products. What is the significance of age to identify? Advanced glycated end products will promote decrease in your metabolism. That means even if you eat less, you'll still have a lot of sugar in your body, because the metabolism is lesser compared to when you don't have that gunk in the mitochondria. The other thing is, it can cause, in the far end of the spectrum, is it can cause mutation of your DNA in the mitochondria. Those, something that you eat from grilling, from high heat food preparation, can mutate the DNA, produce bad proteins, and those bad proteins can produce cancer cells, or cancer, promotes cancer. So that's the age. That's why grilling is not. It's not a safe. It's not a healthy way of cooking. That's why I'm promoting boiling, steaming, or slow cook like crock pot. What else is there in the horizon? Inflammation that can actually settle in the joints, the small joints or the knee joints. If you have arthritis, that arthritis had started a long time ago, and in fact, the diversity of your microbiome dictates the occurrence of arthritis in the near future. What I'm saying is that there are trillions of bacteria, a balance between good and bad bacteria. But if you have predominance of bad bacteria that produces less of the butyrate or the short chain fatty acid, but rather on the medium chain fatty acid, you will be predisposed to arthritis. In fact, that's what you call a alpha diversity. So when you think about this, there's the United States is filled with diverse race. That's healthy. In the same in the intestine, if you don't have much of diversity in your gut microbiome, it becomes a problem. Thanks for watching, Ms. Perla. For example, the predominance of bacteria, for example, that's been studied well. Provitella. Provitella is not familiar to many of us. It doesn't cause problems like what we have, the streptococcus or E. coli that usually produces urinary tract infection. Provitella is more of it only predominates, but it's seldom discussed in the pathology of human disease. But they found out that if there's predominance of that kind of bacteria, no diversity, there's a predictability that that patient with low diversity or alpha diversity will develop rheumatoid arthritis. There's another type of bacteria also that's been identified called Collinsella. If there's more Collinsella, these bacteria will produce citrullinization. Citrulline crystals are the ones that deposit in the joints excuse me, of patients with rheumatoid arthritis. Another bacteria that's really studied well in rheumatoid arthritis is what you call Provitella. This is the bacteria that dwells in the oral cavity. That's why I always tell my patients, brush your teeth first thing in the morning after you do your morning offering. So to decrease the population of those bad bacteria that might potentially go to your intestine, clean them up. You have no idea how much bad bacteria can proliferate overnight, because it's just like when we're making yogurt. Over the 12-hour period that your mouth is uh, is closed, it becomes a medium of growth of this bad bacteria. That's why you need to minimize the growth before and after. So that's the bad bacteria. So how do you approach? You don't kill the bad bacteria with antibiotics, because you will demolish the good bacteria. What you do is to produce the high count yogurt, like exponentially multiplying every hour. That's why if you ferment like a 10 billion colony forming unit of bacteria, in the next hour, you have 20 billion. On the third hour, you have 40 billion. So on, 40, 80, 160, and eventually at 36 hours, you have more bacteria than any capsule can get. So there are different types of bacteria that have been associated and studied. For example, Lactobacillus gasseri. Not only is it good for metabolism, um, for weight loss and waistline decrease, to decrease your metabolic risk for metabolic syndrome. Lactobacillus rotari, which is also good for skin, also is good for joints. A combination, for example, of Lactobacillus rotari and Cassia, or even Rhamnosus, are good combination to decrease the symptoms. There's a specific study that was tapped that the combination of Lactobacillus rotari, Rhamnosus, and Cassia decreased the joint symptoms objectively and subjectively actually in the studies significantly. So the joint pains improved just with microbiome. Why is this? Because the microbiome decreases the production of lipopolysaccharide, which are inflammatory. How do I manifest lipopolysaccharide? For example, when you're running marathon, what do they give you? They give you a silver coat to cool you down. Why? Because the lipopolysaccharide is increased when you're cortisol, when you're stressed, when you're having a long run. Cortisol goes up, sugar goes up, inflammation goes up. Sugar is very inflammatory, so forget about the sugar. Get something else. Fast first with eating less of sugar. So lipopolysaccharide story is that you feel shivering. That is the effect of lipopolysaccharide. That is exactly the symptom when you have fever, when you have infection. That is a lipopolysaccharide effect, that you're shivering. It's not the bacteria that causes you to shiver, but the lipopolysaccharide, the inflammatory substance that is causing this to happen. The microbiome decreases the production of lipopolysaccharide. That is the reason why, and that's just one marker of inflammation. It becomes important for us to take care of the microbiome. The diversity is very important, not just taking one microbiome throughout your life, but to diversify. That's why good bacteria count on different types of bacteria is important. Diversify your bacteria. Or you can mix your bacteria that you have in one sitting. You're assured of some good variety. So that's the principle of making a bacteria. The second principle of making your gut bacteria healthy is fiber. Fiber is very important, because without the fiber, you don't really eat that for you. You're eating that for your microbiome. The microbiome needs to ferment this fiber to produce the short chain fatty acid like butyrate, acetate, and propionate. If you remember, butyrate, that's in the butter. Those are good food. Butyrate, acetate, and propionate, that is needed in the healing of the leaky gut in the intestine. And the more, you also need to improve the population of your good bacteria, which also produces mucin, which is usually taken out and exposes the intestine to allow bacteria to go in. And that's the reason why you have leaky gut, and dysbiosis, or that lack of balance of good and bad bacteria, predominantly bad bacteria, will produce the you're opening up the gates of autoimmune diseases. So back again to arthritis. The more studies are coming out that even osteoarthritis, let alone rheumatoid arthritis, we know that for a fact now, there's more studies. Osteoarthritis also can be predicted if you have less count of lactobacillus or different species. However, with the yogurt that we're making, although we're specifying that this is Lactobacillus gasseri or this, there's got to be other subspecies of the Lactobacillus that supports, because it's difficult to isolate those things. So you're good if you're taking a specific type of bacteria, most likely also diversified in others small quantity of Lactobacillus species. But osteoarthritis, for example, in healthy mice who receive microbiome transplant, they're healthy mice, and they got a transplantation of microbiome who had osteoarthritis. Guess what happened to these healthy mice transplanted with bacteria coming from mice with osteoarthritis? These young mice, just because of the transplantation of the microbiome, develop arthritis immediately. So you can induce yourself to have osteoarthritis if you don't eat fiber, if you don't diversify your microbiome. And the more if you increase your inflammatory substance, sugar. Because sugar in itself also can kill the good bacteria. It will lessen the diversity of the population of the good bacteria. The DNA makeup of healthy individuals, human knee and hip cartilage, differs significantly from those with osteoarthritis, from normal. There's lesser diversity, or what you call alpha diversity, on patients with osteoarthritis. So there you go again. The microbiome has a significant role in arthritis. That's just a symptom of aging in the knee. But the whole system is also inflamed. That's why it's called inflammaging. That's why, again, diversity. Diet is very important. High fiber, less sugar. Remember, refined carbohydrates brings you to high sugar content. That's why you need to get less carbohydrates. And I've seen this many times. People who eat bread, pasta, white potatoes, the fasting blood sugar is up, hemoglobin A1C is up, high sensitivity CRP or CRP, inflammatory marker, is up. And this is very consistent with inflammation. I have a patient also who has a giant cell arteritis, and he has no symptom, but the blood shows inflammation consistently. So I'm giving him intravenous vitamins and some other things that I can discuss with you offline. And also he's getting yogurt regularly. The leaky gut, again, allows this lipopolysaccharide, the bacterial products of inflammation, to get into the bloodstream. That's why you have, although it's in the gut, it goes to the brain, manifests as inflammation of the brain called Alzheimer's. In the eyes, cataracts. In the heart, it can be coronary artery disease or thickening of the blood vessels that predisposes you to heart attack and stroke. In the gut, also, it can give you those kind of symptoms of dysbiosis as manifested by even dyspepsia or unspecific symptoms like acid symptoms. Worse is constipation and sometimes diarrhea. The gut microbes can influence immune cells, for example, T cells that migrate to the joints. So you will not think that wear and tear just because you are using your knees a lot is the ultimate answer of the causation of the arthritis, especially degenerative arthritis. It is also contributed from the gut, and the gut has microbiome, diet, fiber. What about hydration? It is very important because hydration, the gut microbiome cannot really ferment properly if you're not hydrating them well. The bottom line is a systemic from the hair to the tip of the toe, low-grade inflammation that is gut-derived, signals the joint cartilage. So you can still save your joint. You can revert by doing some good habit of having a good bacterial count by taking yogurt. Perla, you were not here, but we do make a yogurt here. Um, you can go to my YouTube channel. There's a lot of instructions there on how to make a yogurt. Example, the related is metabolism, is obesity. It is also connected to the immune function and gut-brain axis. There is a strong evidence or observation that obesity in itself shows a specific pattern of microbiome. It is the same as alpha diversity, low bacterial count of the good bacteria, and high on the bad bacteria that produces medium chain fatty acid as opposed to the short chain fatty acids. So the healthier you have in your microbiome, the less metabolic disease, the less inflammation you have. And that is the reason why Lactobacillus plantarum PS128, which is marketed as Neutrali, and we have successfully made a yogurt. We still have to validate it with a colony count from our friend. So it's more delicious, actually. It's less pungent. It's quite nice in terms of diversity. So you can get a scoop of plantarum, tablespoon of this and that, so that your yogurt becomes a good source of diversity. So we talk about probiotics, prebiotics, the fiber, the Mediterranean style eating. Forget about having a lot of different types of salad. What do you call this? Salad dressing. The law should be balsamic vinegar, olive oil, and lemon. That should be the simple salad dressing that we should be using. So we know about the fecal microbiota transplantation from the mice that had been evidenced that if even a young mice who has no arthritis is given the microbiota of the old mice, they develop arthritis. And actually it's the reverse also. The old mice, when they're given transplantation of the good bacteria from the young mice, they revert the symptoms, signs of arthritis. So now let's go to the what treatment can we have? Unfortunately, the mainstream medicine can only offer this for arthritis. Because you have pain, then you get a pain medicine. Starts with Tylenol. Usually it's about equivalent with NSAIDs like Motrin, naproxen. Naproxen or NSAIDs have higher systemic effects. Number one, gastric ulcer. Number two, that's why if you are supposed to take NSAID forever, for some reason, which I don't believe it should be, you should be on PPI, antacid, to avoid gastric ulcer. Number two, it can cause acute interstitial nephritis, allergic reaction in the kidney that can cause acute renal failure and can get you into dialysis at some point, depending on your severity. What are the other choices that you have? They use immunosuppressants like gold, methotrexate, prednisone, and all those the biologics also, like the what do you call this? The immunosuppressant. They're still immunosuppressants, and they can suppress your immunity and can predispose you to infection. My good sister Annabelle is watching. I think she's still in. Oh, she's my sister who came in, and she's walking. Thank God. She is. Just give you an update. She's walking and be able to attend to her the family needs. So she was very happy. What I'm trying to say is this: away with these immunosuppressants, away with these NSAIDs, something that could harm your kidney or harm your liver. Truly, you have something given by God. It's the orthobiologics, your own plasma, your own PRP. And PRP is great because it has an acute inflammatory effect. That's why it can decrease the pain right away. I've seen it. And my sister, who's watching now, um, she was able to, that night that she arrived from California, from a 12-hour travel almost, I injected her knee that night at 6. She said for the first time she slept because her pain in the knee improved significantly. And that explains also the tendinitis that had developed in her groin, medial side, and also in the medial side of the knee. That's why it improved. And the PRP has this character of rejuvenating the cells. So go back again to the pathophysiology of osteoarthritis. So knee and knee bone right here, you have the synovial fluid that's supposed to bathe the joint to make it cushiony. As you age, because of many different things, slow inflammation associated with sugar, metabolic syndrome, and also the wear and tear, which is really not much of the cause. It's really the slow inflammation associated with metabolism, sugar. That's why you cannot treat arthritis without eliminating sugar, and that is coming from refined carbohydrates, rice, pasta, bread, white potato, if you don't take care of that. Because the PRP will only help the pain, and it also rejuvenate the synovium, the synovial lining, that can potentially improve the secretion of the synovial fluid that will hopefully lubricate the joint. So that's PRP. When I attended the seminar 2 weeks ago, they have now promoted the PPX, or you get a higher count of PRP. And I can make a comment after that. I stick with PRP. The other thing is exosome. That's another thing that we discussed about that a week ago, about the benefits of exosome. It's a type of peptide or protein that is secreted by the stem cells. Where do you get the stem cells? From the fat, from the heart muscle, from the brain, from the bone marrow. So they harvest this, spin it, and make it a concentration and put it in a vial, transport it, and becomes that. And there's other other added effects that I can discuss. Pricey, but PRP is handed to you over by the divine intervention or by divine gift that you can actually try first. Stem cell is good for conditions that are broken. For example, you have a broken tear ligament. Essentially, that stem cell will grow. If you put it near that bone or the ligament, it will grow and become a new tissue that can recover that partition that is gapped. That's stem cell. We can do that. We can do bone marrow aspiration. Other sources would be umbilical cord from other source. But if you have a bone marrow that we can aspirate, it's actually much better because it's yours. So as a conclusion, arthritis is not just a wear and tear. Arthritis, rheumatoid arthritis, comes from the gut, comes from a leaky gut dysbiosis, and the leaky gut that allowed proteins to go in and causes remote inflammation to the joints, even to the inflammation of the brain. Autoimmune associated arthritis like psoriasis, lupus, systemic lupus erythematosus, these are arthritis obviously treated usually by the mainstream medicine with immunomodulators, with immunosuppressants, NSAIDs, which has its own side effects, serious ones, like, for example, predisposition to infection. There are treatments that we can use, PRP. But to have a comprehensive approach of arthritis, it cannot just be going to the treatment, but you have to go back why it happened. And actually, it starts from the gut. It starts from leveling down the inflammation and starts with the diet, avoiding sugar or source of sugar. The other thing of sugar related is cortisol that we always talk about. Stress management. And the stress management, we always have stress. Stress increases the cortisol, which is the the stress hormone. Cortisol increases the sugar because it's a steroid. And the sugar increases the sympathetic tone, which fuels inflammation. How do we improve the stress effect? Guided breathing, and meditation. What is the objective amount of breathing? 6 breaths per minute. You think you would asphyxiate with 6 breaths per minute. It's almost like you're not breathing. But count the math. You have 10 seconds per 60 minutes, or 60 seconds, which is 1 minute. So if you make a calculation per breath, you inhale 4, you exhale 6, you have 10 counts, 10 seconds. You do another one, that becomes 20 seconds. 4, 6. You do another one, that's 30 seconds. You do another 3 more, that becomes 6 breaths per minute. A total of 10 seconds per breath, 6 breaths per minute. So it can be done. When you do this, reset your sympathetic tone from the night, because you have this circadian rhythm. You breathe in, breathe out at least 20 times. You are resetting your sympathetic tone, inflammatory through the night, decrease the cortisol level, and you become less inflammatory when you go. Get yourself the yogurt, hydrate yourself. Maybe just drink a moringa tea, which actually I have made successfully a very tasty moringa tea with clove for a specific reason, because it increases mucin, and also lemon and honey. So you can try it. There's only 2 bottles that I can share today, but I'm planning to make more. I promise.
How much moringa do you put in?
Oh, a lot of moringa tea. I actually specifically I made it like 12 stems of moringa, and then the leaf that I boiled, I ate, and put some honey and what do you call this? Seaweed flakes and yogurt, gaseri, and meat with a steam. So me and my, I steamed I boiled the moringa leaves, and then I put the meat in a bowl. So my best friend and I were had to enjoy. So this is great. No rice, nothing. The only thing that really is the flavor of honey and the yogurt. So that, my dear sister and Perla watching, you can use that for lunch and dinner. Moringa as much as you can. It's so funny because we only associate moringa, boiling moringa, to feed the pigs in the Philippines, which is so pathetic. But now we actually only use this as a soup, which is very dilute. But now you can actually make a moringa. Just give this a try. I just did it. And I have 2 bottles of moringa tea, lemon, and that. So these are the healthy food that you can make. Hydrate yourself with something delicious. I have also, you're familiar with the Ternatia tea, that an artichoke tea, simply boiling and extracting. No genius thinking, because I'm not a genius. So that is, I'll get into a second. So one is diet. Arthritis is related to diet. Stress control is very easy. Meditation, guided breathing in front of the Blessed Sacrament, and nail the art or the practice of meditation, pondering, meditating on the unconditional love of Jesus. And I say it again, and Father Leandro and I always get into good discussion when I try this. It's about knowing the life of Jesus when you meditate. A 2001 study, which was published, a small study published in the British Medical Journal, compared, this is exciting, compared rosary and yoga mantra. Yoga is always used in the corporate world because it has an inflammatory effect. But when they compared the effect of rosary and the yoga, it's the same. The heart rate variability goes up, which you're getting familiar. If your heart rate variability is up because you're breathing slowly in and out, the sympathetic tone decreases. It increases more to the parasympathetic tone, which is less inflammatory. So heart rate variability goes up with rosary and yoga mantra. Why would you go to the yoga? That's an open door for the demonic portal, because it's pride. It's all about them. No. But a rosary is about humbling ourselves in front of the Blessed Sacrament, trying to know Jesus, because once we know Jesus, once we know his passion, according to San Jose Maria Escrivá, he said that the only way you can know Jesus is to know his passion. Santa Teresa of Avila, the same, all the saints. So these are practices that you can do, even without going to the hoping for nirvana. Don't look for the nirvana in a Catholic meditation. Your system improves without even having the feeling. And in fact, Father Leandro said, you don't look for feeling when you go to adoration. The fact that you go there without any feeling and not expecting anything, Jesus is more happy than having to levitate in front of him. So now, meditation, diet, microbiome, we cannot ignore. We cannot ignore the microbiome, but has to be fed with fiber that will decrease also our caloric consumption with refined carbohydrates. And lastly, do not compromise your system by having treatment with the mainstream medicine, NSAIDs, steroids, this. You have PRP, which is accessible. We are experts of PRP, and I'm board certified in regenerative functional medicine and regenerative medicine. We can do it here. We can serve you. With this, we have gone through 30 minutes. Perla Garcia, thank you. My sister Annabelle. I could not identify the YouTube audience. So this is it for now. Thank you very much, and I'll entertain questions. You have questions?
I have several questions.
Sure.
One is regarding fiber.
Yeah,
There's so many.
regarding fiber. Okay.
So I know that cabbage and kale and all these natural, fibers,
Mhm.
way of obtaining fiber is good.
Mhm.
But what about these other things like cereals, and they're probably not good, right?
No good. Cereal, number one, is wheat.
Right.
And we don't want to mess up with wheat or grain. It's inflammatory. So the basic fiber that you want, get a moringa. Plant moringa trees. I have a lot. I can share it with you. Because it can definitely help antioxidation. It decreases blood sugar. But the basic high fiber diet, cruciferous vegetables, which is kale, ABC kale, asparagus, kale, broccoli.
What about watercress? Yeah. Watercress is one of the highest.
Watercress, whatever you can think of high fiber, but not wheat. Directly to your question of cereal.
Okay.
Cereal has nothing really. Like, for example, the one in the box, it's a joke. Try it. Get a cereal, what do you call it, Cheerios? It will just melt. Nothing, no fiber will float.
They've been saying that for years, but
Mhm.
it just doesn't get out there. The message doesn't get carried.
Well,
You look
because
at
the-
shelves in
Yeah, because
supermarket.
the marketing from their side is very powerful.
Maybe JFK and you.
Well, my
Your
yeah.
message.
Another question about risperidol. Okay, so
Respiridol,
which is so.
Resveratrol from grapes.
Well, yes, it's from grapes. So
Okay,
you're saying
resveratrol.
right word.
Mhm.
Can you say it again?
Resveratrol.
Yes. That.
Mhm. Respiridol is a antipsychotic.
I was
Okay.
gonna say, that's what I'm thinking.
So
Yeah.
I mispronounced it.
Yeah.
And you have it right.
Mhm.
And so my question is this: my husband loves raisins,
Mhm.
and he grinds them up,
Mhm.
and he takes like 2 tablespoons a day.
Mhm.
But at the same time, I believe that they contain a lot of sugar.
Absolutely.
And so I'm trying to convince him that
Mhm.
even though this, which is found in this, I don't pronounce it right, but the R word,
Resveratrol.
right, that comes from the grapes or the
Mhm.
raisin,
Yeah.
the skins, trying to get my thought across.
Including the seed, actually.
And the seed within it?
Mhm.
Okay, so is that a good idea to do that every day, or is it harmful?
It could, depending on how much amount of fructose you get, because that's sugar.
Right,
Fructose in general has no storage effect. Like glucose becomes glycogen, fructose does not. So fructose becomes deposited in the liver directly, and it's inflammatory. That is the reason why there is an association of fruit juices in kids developing liver cirrhosis or non-alcoholic fatty liver disease. Take note, not alcohol fatty liver disease. Where before the pathophysiology of liver disease is usually only from alcohol. But how come these kids, it was studied actually in California, that as early as in their elementary school, they develop liver disease, but they don't drink alcohol. It comes from fructose. Fructose is inflammatory. That's why you don't feed your kids with fruit juices. Feed them with whole fruit with fiber. Because as I said, you don't need the fiber, the microbiome needs fiber. In the Philippines, we used to have Yakult. It was still a luxury for us to get them. Yakult is actually Lactobacillus casei shirota. That's a good habit for snacks for kids.
Where does it come
Lactobacillus, it's from fermentation of Lactobacillus casei shirota. You can get that from, but the best there really. Huh?
Where can you get it?
It's in the Publix. But what you can do is really the best is yogurt because yogurt has high count. You're talking about 500 billion colony forming units as opposed to 30 million from those women's and also from 60 billion from whatever. But the yogurt that you're making or you make is in the billions, hundreds of billions. What you say?
I was just going to say, even what about dates and figs? Are those
So yes,
okay
those are
for
good
anyone?
because they're high fiber.
Okay, but the sugar in there won't be.
But as long as you have the fiber, the whole fruit.
Okay.
Yeah.
Got it. Oh, so
So
that.
dates and figs are different from raisins.
Yes.
Those are
Yeah.
high fiber.
Right.
So
Is it fine?
I wonder if there's any question from the social media. Not so far. You have Leah?
Yes, you mentioned a lot about causation and everything else.
Yeah.
But in the email, it can other kinds of.
Rhamnosus, yes. There's so many other bacteria like Lactobacillus rhamnosus, Cassia, Gasseri, Rotary. Those are the top four. Yeah. So they have different properties of how you can grow them, but when you mix them, it's easy. 106. So if you're interested, we can dabble into that as well.
Now, you were saying, I think dates one time you could put in with a smoothie, just one or two,
Yeah,
and that would give you some sweetness.
sweetness and
It's
fiber.
legal.
But
Yeah.
she said they add.
But the best fiber. Can you make yogurt from probiotics 225? Yes, of course. And I think I've not tried it myself, coming from a Sans B40. Just wonder where you're from, where you're at, Sans. So yes, the answer is yes, because it is a mixture of probiotics, but you have to that you can get it from what do you call this? You can adjust the temperature to 106 to you get it from what do you call this? But you don't really need to use the 225 cents because when you ferment it, it exponentially increases every hour. So you really just need the small amount of billion and then exponentially. I know this beautiful woman, Sans. Yes. So yes, I can use this. You can use 225, but not needed. You just need the. And if you need a starter for these new ones, for example, the Lactobacillus plantarum, which is good for memory and preventing Parkinson's, we have it here. We hook you up with some starter, and then learn to mix all these organisms in your yogurt.
What about sauerkraut? A lot of people say that homemade sauerkraut is also.
Yeah, that's a common knowledge. Any fermented food is what you call a prebiotic. These are fiber that feeds the bacteria.
Right.
If you go to my YouTube channel, easy, Raul Enad, there's a lot of information about that, antioxidants, and I encourage you to subscribe and maybe share. What else? Who else do you have questions? So yes, we have Lactobacillus plantarum, specifically the same strain from the capsule that's sold commercially, and I can tell you after off camera, so that I will not be biased by being promoting on something. with that case, I will end the video, and hopefully to see you again next week. And I think that would be the last video live here for this month of July, because I'm accompanying my daughter to compete in a piano competition in Italy. So I'm proud, Daddy. International piano competition in Italy.
Oh,
Piano.
Oh, I'm sorry.
We're going to
Wow.
Italy.
It will be in Ischia, and I explored the island. It's beautiful. So
Wonderful.
it'll be beautiful.
That's great. Is it your
Yes.
youngest daughter
The oldest. She looks like me, just to let you know.
or?
All right, see you then. Bye-bye.